Cervical cancer types explained simply. Imagine your cervix as a gateway between the uterus and the vagina. When cells in this area start growing abnormally, it can lead to cervical cancer. There are different types of cervical cancer, and understanding them helps in early detection and treatment. The most common types are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma makes up about 70 to 90% of cases and develops from flat, thin cells called squamous cells that cover the outer part of the cervix. These cancers usually begin in the transformation zone, where the outer squamous cells meet the inner glandular cells, and are often found during routine Pap smears. Adenocarcinoma accounts for roughly 10 to 20% of cervical cancers. It starts from glandular cells lining the cervical canal, which produce mucus. These tumors tend to develop higher up in the cervix and have been increasing in recent years. Sometimes, a tumor can have features of both squamous cell carcinoma and adenocarcinoma, called adenosquamous carcinoma. This is less common but is treated similarly to the other main types. There are also rare but aggressive tumors known as neuroendocrine tumors, including small cell carcinoma. These are quite uncommon, making up about 1 to 6% of cases, and tend to grow quickly. They involve small cells with a high nucleus to cytoplasm ratio and often requiring different treatment approaches. Very rarely, other types like melanoma, sarcoma, or lymphoma may occur in the cervix, but these are more typical in other parts of the body. It's important to remember that the stage and grade of the cancer, which describe how far it has spread and how abnormal the cells look, are usually more critical for treatment decisions than the specific cell type. Most cervical cancers are linked to persistent infection with high-risk types of human papillomavirus, which is why vaccination and regular screening are so vital for prevention. Knowing the different types of cervical cancer helps doctors tailor treatment plans, which may include surgery, radiation, or chemotherapy, depending on the individual case. Understanding these types also highlights how cervical cancer is a reproductive system disease, different from other reproductive cancers like testicular cancer. Always consult healthcare professionals for personalized advice, and remember that early detection through screening can save lives.